Hello Dr. Talks. Today we are going to discuss about knee replacement. To discuss more on this, today with us Dr. Mrinal Prakash. Dr. Mrinal Prakash, MS and DNB Orthopaedics from Mumbai. He is a specialist in robotic joint replacement surgery. He has done fellowship in robotic joint replacement surgery and arthroscopy from Kim's Sunshine Hospital, Hyderabad. Doctor, what are the common reasons that lead to need for the knee replacement surgery?
So, the main indication for any joint replacement surgery is injury to the cartilage. So, that injury to the cartilage can lead to arthritis of the joint. So, I'll explain you what is arthritis. Every joint in the body has a 2 millimeter layer of cartilage around the bone. The cartilage is soft and there is no friction when two cartilage move on each other. So, we can have painful range of motion of any joint. Now, because of any reason like any trauma, any infection, cancer, or any inflammatory diseases like rheumatoid arthritis, if this cartilage gets destroyed, this can lead to arthritis. Now, arthritis has 4 stages 1, 2, 3, 4. Fourth is the last stage where there is no cartilage left. In that case, we do total knee replacement. One important thing is we don't treat the x-ray, we treat the patient. So, if a patient has pain along with stage 4 arthritis, in those cases only we'll go ahead with surgery. If the patient has stage 4 arthritis but there is no pain, so we can wait it out.
Doctor, can you explain the process of knee replacement surgery?
Yes, in knee replacement surgery, as we discussed, there is injury to the cartilage. So, knee replacement is a type of resurfacing arthroplasty where we cut the cartilage that is around the bone and we put the implant there. So, we don't cut the whole bone, we cut just the layer where the cartilage is bad and we put the implants.
Doctor, what medical tests and evaluations are usually done before the surgery?
So, in orthopedics, we say life is more important than limb. So, patient's evaluation is very important. So, we start with x-rays. Standing x-rays are taken of the knee where we see the cartilage and the bone quality. We do chest x-rays, we do all the blood tests. After that, we do ECG, 2D echo. And once all these tests are done, the patient goes to general medicine doctor. He evaluates the patient, and then after the evaluation is done, after the patient is fit for the surgery from his end, the patient goes to the anesthetist. The anesthetists do pre-anesthesia checkup of the patient, and when he feels that the patient is fit for the surgery, we go ahead with the surgery. If he requires more tests, then we send the patient back to the lab, we get all the tests done, and then only we go ahead with the surgery. And even when we have planned the surgery, we keep the patient in the ICU for one night, and in the morning at the time of dressing, if the patient's vitals are normal, if the blood parameters are normal, then only we shift the patient to the room.
Doctor, what type of anesthesia used for the knee replacement surgery?
So, choice of anesthesia is totally dependent on the anesthetists. But most commonly, we do a spinal anesthesia where we give small injection at the lower back and the patient sensation goes, there is no sensation below waist of the patient and we go ahead with the surgery. In few cases, general anesthesia is required.
Doctor, what should be done in early post-operative period?
So, in this case, counseling becomes very important. We have to tell the patient about the pain, swelling, difficulty in walking in the beginning of the recovery. So, a doctor should give realistic goals to the patient. He has to tell the patient that in first 2 to 3 weeks, there will be some pain, there will be some swelling. So, the patient has to overcome that and do the physiotherapy. Now, physiotherapy in the early stages is very, very important because in total knee replacement, we are just fixing the joint. We are not doing anything with the muscles. Now, we need good power in the muscles for the patient to walk. I'll give you a simple example. Suppose a car is not working because of bad engine. Now, if we change the engine, if you put a new one and we don't put petrol in the car will not run. Similarly, if the joints are good but the muscles are weak, the patient will not be able to walk. So we have to tell the patient that he has to do good physiotherapy, especially in the first 1 to 2 months, to have a good recovery. And normally, if you ask me a phase, in 2 to 3 months, patients are almost pain-free and they're able to return to their normal activities.
Doctor, what are the common risks and complicated associated with knee replacement surgery?
Right. So this is the most important question and the most important reason why in India or in the world most of the patients are not going ahead with the surgery. It is the fear of the complications. So I'll tell you in detail. If we divide the question in two parts, some complications are due to the surgeon and the surgery, and some complications are due to the patients. Now, coming to the surgeon and surgery, yes, I agree, any surgery is associated with some complications. In this case, it could be any injury to the nerve or the vessels, it could be some infection, it could be a fracture, but we have to know that all these complications are avoidable if they are done by a good experienced surgeon. Loosely speaking, we can say that there is a chance of injury while traveling on the road also, but we travel. So, if we are taking all the precautions, if we are going good pre-operative checkup of the patient and the surgeon is experienced, then the chances of complications are very less. Now, coming to the patient side, some patients don't take care of the surgical site. Sometimes we see patients coming with food particles on the dressing, sometimes urine, dirt. So all these things increase the chances of infection. Some patients don't do physiotherapy after surgery. So in that case, the range of motion is not good. Patients complain of excessive pain, swelling. So these things should be taken care by the patient. A simple thing like sugar, if it is not controlled in post-operative period by the patient, can lead to infection of the joint. So if all these things are taken care of, then the risk of complication and risks are very less.
Doctor, what are some important precautions need to be taken after knee replacement surgery?
So in the immediate post-op period, like we discussed, patients should take good care of the skin, the surgical site. It should be clean. The dressing should look white. Patients should do proper physiotherapy. Patients should give at least half an hour morning and evening to the physiotherapy, because the results are very, very good if the patient does good physiotherapy in the early 2 to 3 months. Patient should have a very good diet, high protein diet. Patient should do regular follow up in the beginning. Like first follow up should happen at 2 weeks when he goes for stitches removal. Next follow up should be done at 1 month, and after that the patient should come for follow up after 3 months. All these factors should be taken care of by the patient.
Doctor, what should patients do for better long-term results after knee replacement surgery?
For the best long term results, patient should choose a good surgeon who is experienced, who is trained in knee replacements, a hospital where all the departments are available, like physiotherapy department is there, good ICU and intensive care unit is there, cardiac doctors, neuro doctors, all these doctors are available, because it is the whole team that operates and not just a single person. Also, for good long-term results, patients should do regular physiotherapy, patients should work on the muscles, have good nutrition, and do regular checkups, follow-ups, post-surgery also.
Doctor, what is the role of robotics in knee replacement surgery?
So robotics are there in soft tissue surgery since a very long time. It is relatively new when it comes to orthopedics. In India, it is there since last 4-5 years. We use in our center Striker Mako robot, so I can vouch for that. What happens in robotics is that we take CT scan of the patient before the surgery. We do planning. By planning, we know exactly what is the anatomy, how the bone looks like, is there any defect. So we can plan ahead so that during surgery there are less surprises for us. Now, when we are operating, the accuracy of a robot is very high. It is more than a millimeter. So, because of accuracy, the results are better. We take small incision, that is the cut that we take on the skin is smaller. There is less injury to the soft tissues, which leads to less blood loss, and all these things lead to early recovery of the patient. I have published an international article on that, where we did one non-robotic on one side and robotic on the opposite side of the knee, and we saw that in early recovery was there in robotic operated patients.
We have covered all the questions related to knee replacement surgery. If you have still any doubts, kindly mention in the comment box.